Welcome to this training course provided by easyemsceu.com, your trusted source for continuing education for EMS professionals. Today's course will focus on a critical topic facing our communities and first responders, recognizing and managing opioid overdoses, including the proper use of Narcan or Naloxone. As opioid-related emergencies continue to rise, it's essential for EMS providers at every level to understand the underlying pathophysiology, identify overdose signs quickly, administer life-saving interventions, and provide appropriate post-care management. This course is designed to give you the knowledge and confidence to respond effectively and help save lives in these challenging and often time-sensitive situations. Understanding the pathophysiology of opioid overdose is essential for any EMS provider. Opioids exert their effects by binding to specific receptors in the central nervous system, primarily the mu-opioid receptors. While this interaction provides effective pain relief, it also depresses the respiratory drive. In cases of overdose, excessive activation of these receptors can lead to severe respiratory depression, resulting in hypoxia, brain injury, or death if not promptly treated. Recognizing the signs and symptoms of an opioid overdose is critical to providing timely care. Common indicators include pinpoint pupils, unconsciousness or an altered mental status, slowed or absent breathing, cyanosis, and sometimes a history or evidence of drug use at the scene. Rapid identification of these symptoms can mean the difference between life and death. Once an overdose is suspected, EMS providers must review and apply the appropriate use of Narcan, also known as Naloxone. Naloxone is an opioid antagonist that competitively binds to the same receptors as opioids, effectively displacing them and reversing their life-threatening effects. It can be administered intranasally, intramuscularly, or intravenously, depending on the situation and available equipment. EMS personnel should be familiar with local protocols, dosing guidelines, and techniques for safe and effective administration. However, the administration of Naloxone is not the end of care. Post-administration management is equally vital. Patients may regain consciousness abruptly and could present with agitation, nausea, vomiting, or even signs of acute opioid withdrawal. Continuous monitoring of airway, breathing, and circulation is necessary, and further supportive care should be provided. In some cases, multiple doses of Naloxone may be required due to the potency or long-acting nature of the opioid involved. Prompt transport to an appropriate medical facility for continued evaluation and care is always recommended following Naloxone administration. By understanding the pathophysiology, recognizing overdose signs, administering Naloxone appropriately, and ensuring comprehensive post-administration care, EMS providers can significantly improve patient outcomes in opioid overdose emergencies. Let's take a closer look at the substances most commonly involved in opioid overdoses. Common opioids include heroin, fentanyl, morphine, and oxycodone. Heroin is an illicit opioid with no accepted medical use, but fentanyl, morphine, and oxycodone are prescribed medications frequently used for pain management. Unfortunately, even prescription opioids carry a high potential for misuse and dependence. All opioids function as central nervous system, or CNS, depressants. They slow brain activity and suppress essential autonomic functions, especially breathing. This is why, in overdose situations, the primary life threat is respiratory depression. Without sufficient breathing, the patient quickly experiences hypoxia, which can lead to unconsciousness, brain injury, or death. It's important to remember that the potency of these opioids can vary significantly. Synthetic opioids like fentanyl are especially dangerous because they are much more potent than natural opioids and can cause rapid, severe respiratory compromise, often requiring higher or multiple doses of Naloxone for reversal. Understanding the nature of these drugs helps EMS providers anticipate the severity of an overdose and prepare for appropriate intervention. Opioids exert their effects by binding to specific receptors in the brain, primarily the opioid receptors. These receptors are responsible for regulating pain, reward, and respiratory function. When opioids occupy these receptors, they effectively reduce the perception of pain and can produce feelings of relaxation or euphoria. However, this binding also has dangerous side effects. One of the most critical is the suppression of the respiratory drive. The brain's natural signals that control breathing become dampened, causing slower and shallower respirations. In overdose situations, this can progress to complete respiratory arrest. Without sufficient oxygen intake, the body quickly becomes hypoxic. If hypoxia is not corrected promptly, it can lead to severe brain injury and eventually cardiac arrest. This chain of events highlights why opioid overdoses are so dangerous and why rapid recognition and intervention are vital for a positive outcome. Several risk factors increase a person's likelihood of experiencing an opioid overdose, and understanding these can help EMS providers better anticipate and manage these emergencies. First, opioid dependence is a major factor. Individuals who use opioids regularly develop tolerance, meaning they require higher doses to achieve the same effect. However, tolerance to the euphoric effects often develops faster than tolerance to respiratory depression. This imbalance increases the risk of overdose, especially when dosing becomes unpredictable or escalates. Next is polydrug use, the concurrent use of multiple substances, particularly other central nervous system depressants such as alcohol, benzodiazepines, or sedatives. These combinations can have synergistic effects, significantly increasing the risk of profound respiratory depression and death. Unfortunately, many patients may not be fully aware of how dangerous these drug combinations can be. A third risk factor is recent detoxification or release from incarceration. After a period of abstinence, an individual's tolerance to opioids decreases significantly. If they relapse and use a dose similar to what they previously tolerated, they are at high risk of overdose because their body can no longer process the same amounts of the drug safely. This is a common and tragic scenario EMS providers often encounter. Finally, inconsistent drug purity is a major contributor to overdose risk, especially in illicit drug markets. Users may receive substances that vary wildly in potency, and even small amounts of highly potent synthetic opioids like fentanyl or carfentanil can be lethal. Because street drugs are often cut with unknown substances, individuals can be exposed to much stronger opioids than intended without their knowledge. By being aware of these risk factors, opioid dependence, polydrug use, recent detoxification, and inconsistent purity, EMS personnel can better recognize vulnerable patients and understand the underlying circumstances that lead to opioid overdose incidents. Recognizing the signs and symptoms of an opioid overdose is essential for timely and effective intervention. One of the most critical indicators is decreased or absent respirations. Opioids suppress the brain's respiratory centers, leading to slower breathing or complete respiratory arrest. As EMS providers, assessing the adequacy of respirations is a top priority. Look for slow, shallow breaths or complete apnea, which are life-threatening conditions requiring immediate action. Another classic sign is pinpoint pupils, also known as meiosis. While not present in every overdose, especially when polydrug use is involved, pinpoint pupils are highly suggestive of opioid involvement. This finding, combined with respiratory depression, strengthens the clinical suspicion of an opioid overdose. Cyanosis, or the bluish discoloration of the lips, skin, or nail beds, is another hallmark of opioid overdose. It reflects significant hypoxia, an inadequate level of oxygen in the blood. Cyanosis is a late sign, indicating that the patient's oxygenation has been critically compromised. Immediate intervention is necessary to prevent further deterioration. Finally, unconsciousness is commonly observed in opioid overdoses. Patients may be unresponsive to verbal commands and painful stimuli. This altered level of consciousness results from both hypoxia and the central nervous system depressant effects of opioids. It also increases the risk of airway obstruction due to tongue relaxation or aspiration of vomitus, further complicating the situation. Recognizing these four key signs, decreased or absent respirations, pinpoint pupils, cyanosis, and unconsciousness, enables EMS providers to rapidly identify opioid overdoses and initiate appropriate treatment. Quick recognition and response are critical to preventing irreversible brain injury or death. Always maintain a high index of suspicion, especially in known high-risk populations or when drug paraphernalia is present at the scene. Before administering Narcan or any other intervention, airway management must always be the top priority. The first step is to ensure the airway is patent. In opioid overdose patients, the airway is frequently compromised due to unconsciousness and loss of muscle tone, causing the tongue to fall back and obstruct airflow. A quick head tilt chin lift or jaw thrust maneuver can help open the airway, but care must be taken, especially if trauma is suspected. If there are any obstructions or secretions, suction should be used as needed. Vomitus, blood, or other fluids can easily block the airway, especially in unresponsive patients. Prompt and effective suctioning is critical to prevent aspiration and to clear the airway for adequate ventilation. Once the airway is cleared, consider airway adjuncts such as oropharyngeal or nasopharyngeal airways, particularly in patients who are unresponsive and unable to maintain their airway independently. These devices help keep the airway open and facilitate effective ventilation while minimizing the risk of obstruction. Remember to assess for a gag reflex before placing an oropharyngeal airway to avoid inducing vomiting. Finally, and this is crucial, oxygen should always be administered prior to giving Narcan. The primary threat in opioid overdose is hypoxia, not the opioid itself. Reversing the opioid effect without first addressing hypoxia can lead to sudden arousal, agitation, or even combativeness in the patient, especially when they awaken in a hypoxic state. Providing supplemental oxygen helps correct hypoxia and supports respiratory function, even before Narcan takes effect. In many cases, oxygen administration alone can temporarily stabilize the patient's condition and buy valuable time for further interventions. By prioritizing airway management, clearing obstructions, using adjuncts when needed, and administering oxygen promptly, EMS providers set the foundation for successful Narcan administration and improved patient outcomes. Narcan, also known by its generic name Naloxone, is a life-saving medication classified as an opioid antagonist. This means that it binds to the same receptors in the brain that opioids target, primarily the mu-opioid receptors, but instead of activating them, naloxone blocks them. By occupying these receptors, naloxone displaces any opioids that are present, preventing them from exerting their effects, particularly the suppression of the respiratory drive. Naloxone temporarily reverses opioid effects, which is a crucial point for EMS providers to understand. While naloxone can rapidly restore normal breathing and consciousness, its effects typically last between 30 to 90 minutes. However, many opioids, especially long-acting formulations or potent synthetic opioids like fentanyl, can remain active in the body for much longer. This means that symptoms of overdose can return after naloxone wears off, a phenomenon known as re-narcotization. Continuous monitoring and potential repeated dosing are often necessary in the pre-hospital and hospital settings. Intranasal administration has become the most common route for naloxone delivery, especially in the pre-hospital environment and by laypersons. The intranasal form is easy to administer, requires no needles, and minimizes the risk of needle stick injuries. The Narcan nasal spray delivers a pre-measured dose of naloxone and can be quickly applied, even by bystanders with minimal training. Intranasal naloxone has proven to be both effective and practical for rapid response to opioid overdoses. In some cases, particularly in advanced life support settings, naloxone hydrochloride can also be administered intramuscularly or intravenously, providing flexibility depending on the situation and the provider's scope of practice. Regardless of the route, the goal remains the same: to reverse life-threatening respiratory depression and buy time for more definitive care. Understanding how naloxone works and how to administer it effectively is a cornerstone of opioid overdose management and a critical skill for every EMS provider. Naloxone can be administered through several routes depending on provider level and situation. Intranasal administration is preferred for BLS providers due to its ease of use, minimal training requirements, and non-invasive nature. It allows for rapid administration without the need for needles, reducing the risk of needle stick injuries and making it ideal for both pre-hospital settings and bystander use. ALS providers may administer naloxone intramuscularly or intravenously, allowing for faster onset and more precise dosage control in advanced care situations. The recommended intranasal dose of naloxone is 2 to 4 mg per administration, though providers should always follow their local protocols for specific dosing guidelines. If the patient does not respond adequately, the dose may be repeated every 2 to 5 minutes as needed until effective respiration is restored or advanced care is available. To administer intranasal naloxone, begin by tilting the patient's head back to open the airway and provide gentle support to the neck to prevent movement. Insert the tip of the nasal spray device into one nostril until your fingers firmly touch the outside of the nose, ensuring a good seal. Press the plunger firmly to deliver the full dose into the nasal cavity. Before administering, make sure the airway is clear and suction any secretions if necessary. If the patient is apneic or has poor respiratory effort, provide rescue breaths or perform basic airway maneuvers while preparing the naloxone. Administer the dose quickly and firmly, as delays can reduce its effectiveness. Be prepared for the patient to awaken suddenly and possibly become agitated or combative. Continue to monitor for improved breathing and responsiveness, but be ready to repeat the dose in 2 to 5 minutes if there is no response. Always prioritize airway management and safety while preparing for possible repeat administrations or additional interventions. To administer intranasal naloxone, begin by tilting the patient's head back to open the airway and provide gentle support to the neck to prevent movement. Insert the tip of the nasal spray device into one nostril until your fingers firmly touch the outside of the nose, ensuring a good seal. Press the plunger firmly to deliver the full dose into the nasal cavity. Before administering, make sure the airway is clear and suction any secretions if necessary. If the patient is apneic or has poor respiratory effort, provide rescue breaths or perform basic airway maneuvers while preparing the naloxone. Administer the dose quickly and firmly, as delays can reduce its effectiveness. Be prepared for the patient to awaken suddenly and possibly become agitated or combative. Continue to monitor for improved breathing and responsiveness, but be ready to repeat the dose in 2 to 5 minutes if there is no response. Always prioritize airway management and safety while preparing for possible repeat administrations or additional interventions. The pre-filled Narcan, or naloxone, syringe contains a standard dose of 2 mg in 2 ml of solution. It's important to note that the MAD device, also known as the mucosal atomization device or atomizer, is not included in the box and must be added separately before use. Once the medication has been administered, the entire syringe should be disposed of in a sharps container. This is crucial because there is a needle embedded within the syringe barrel, which poses a safety risk if not handled properly. Always ensure proper disposal protocols are followed to maintain scene safety and prevent accidental needle sticks. To begin preparing the medication for administration, remove the colored caps from both the medication vial and the syringe barrel. This step exposes the connection points and allows you to assemble the components properly. Make sure to keep the exposed ends sterile by avoiding contact with any surfaces. Removing the caps is essential to ensure a secure and leak-free connection when attaching the vial to the syringe or connecting other necessary devices, such as an atomizer or needle, depending on the intended route of administration. After removing the protective caps from both the syringe barrel and the medication vial, twist the atomizer securely onto the tip of the syringe barrel. Make sure the atomizer is threaded properly and tightened to prevent any leakage or disconnection during administration. A firm connection ensures that the medication will be delivered effectively as a fine mist into the nasal cavity. Avoid over-tightening, as this can damage the components or make removal difficult later. Once the atomizer is attached, the device is ready for intranasal administration. Always double-check the connection before proceeding to ensure patient safety. Insert the medication vial into the open end of the syringe barrel, aligning it carefully to avoid cross-threading. Slowly turn the vial clockwise until it stops, ensuring a firm and secure connection. This step allows the syringe and vial to lock together, creating a closed system ready for medication delivery. Be careful not to over-tighten, as this could damage the threading or make removal difficult later. Once attached, double-check that the connection is stable and that the medication is ready for administration without any leaks. Maintaining a steady and gentle turning motion helps prevent damage and ensures proper alignment of the components. At this point, the medication is fully prepared and ready to be administered. Ensure that all connections between the vial, syringe barrel, and atomizer are secure and that there are no leaks. Follow your local protocol regarding the appropriate dosage and administration technique. Always verify the patient's condition and confirm that naloxone administration is indicated. Once everything is ready, proceed with delivering the medication while continuing to monitor the patient's airway, breathing, and responsiveness throughout the process. Be prepared to repeat the dose as necessary according to your agency's guidelines. After administering naloxone, continue to closely monitor the patient's airway and breathing for any signs of improvement or deterioration. Be aware that the patient may experience agitation or withdrawal symptoms as the opioid effects are reversed, which can include confusion, restlessness, or combativeness. Anticipate the possibility of vomiting, and prepare by positioning the patient in the recovery position to protect the airway and reduce the risk of aspiration. Additionally, be ready to administer repeat doses if the patient's respiratory status does not improve or if symptoms return, following your local protocols. Continuous monitoring and readiness to intervene are essential components of effective post-administration care. Be aware that polysubstance overdoses may not respond fully to naloxone administration. If multiple substances are involved, especially non-opioid depressants or stimulants, the patient's condition may remain compromised despite reversing the opioid effects. It's also important to remember that Narcan has a shorter half-life than some opioids, meaning the medication's effects may wear off while the opioid remains active in the body. As a result, symptoms of overdose can return after initial improvement. For this reason, always transport the patient to a medical facility, even if symptoms improve following naloxone administration. Continuous monitoring and advanced care are essential to ensure the patient's safety and address potential rebound effects or complications. When administering naloxone, always use an age and weight-appropriate dose as outlined in your local protocol. Pediatric and elderly patients may require adjusted dosing to ensure both effectiveness and safety. After administration, monitor the patient closely for any adverse effects, such as agitation, changes in vital signs, or signs of allergic reaction. Continuous observation is essential to assess the patient's response to the medication and to identify any potential complications early, allowing for prompt intervention if needed. It's essential to document key details following Narcan administration. Record the exact time and the dose of Narcan given to provide an accurate timeline for medical providers and ensure proper continuity of care. Note the patient's response, including changes in breathing, consciousness, or any adverse effects observed after administration. Additionally, include any ongoing observations and care provided, such as airway management, repeated doses, or patient positioning. Thorough and accurate documentation is critical for both patient safety and legal compliance, and it assists receiving medical personnel in delivering appropriate continued treatment. Let's take a moment to review the key points covered in this training. Early recognition and quick intervention are absolutely critical when responding to an opioid overdose. When used properly, Narcan can save lives by rapidly reversing respiratory depression and restoring breathing. But giving Narcan is just the beginning. After administration, it's essential to carefully monitor the patient's airway, breathing, and responsiveness. Even if the patient appears to improve, always arrange for transport to a medical facility. Remember, Narcan's effects may wear off before the opioid has fully cleared from the patient's system, and symptoms can return. Continuous monitoring and prompt transport are vital to ensure the patient's safety and provide any additional care that might be needed. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And thank you for visiting easyemscu.com.